Good morning, my name is Bob Keller. I am recently retired from my position as administrator of the McLean County Health Department, and I serve today as a part-time consultant with the Illinois Public Health Association, and my testimony today is presented on behalf of the Illinois Public Health Association. IPHA is a 6,000-member organization devoted exclusively to matters of public health. We are here today to express our concern with one of public health's greatest and most well-understood threats, the interrelatedness of obesity and chronic and debilitating disease, often called chronic disease. It is predicted that obesity epidemic will make today's children the first generation of Americans to have shorter lifespans than their parents, and this really is not acceptable. It is well understood that universally accepted by public health science that the health consequences of obesity are staggering and include diabetes, heart disease, hypertension, asthma, and some cancers, and a host of other physical chronic conditions. In addition to the human cost of obesity, if left untreated or partially treated, the cost in terms of lost economic stability, medical treatment, pharmaceutical support, and the long-term health care adds up to the state and national financial catastrophe. So here's what our message today is. We must look at issues of obesity in terms of our next steps from a much broader perspective. It is imperative that we avoid disparate Band-Aid strategies that instead embrace a comprehensive, big picture approach to the prevention of chronic disease. IPHA believes this can only be accomplished by building a sustainable public health infrastructure that is centralized around local health departments, maximizing their role and resources to positively impact chronic disease in their communities. This is the role of local public health. This is the responsibility of the local public health system. And to accomplish this role and responsibility, it is understood that a wide and comprehensive community mobilization partnership must exist. The partnership of schools and parents, employers and employees, social and faith organizations, and every other imaginable interest will need to collectively focus on the true underlying causes of this emerging epidemic. Economic stability, social equality, education, access to preventive care, access to medical care, and quality of life factors must also be simultaneously addressed if any impact is to be expected. This is a large order, and as a public health community, we must demand that a longitudinal, comprehensive, wide-ranging approach be used. And we must be diligent and not accept simplistic and ineffectual short-term solutions. The significance of obesity and the impact on health is well established and understood by our local health departments. Each year they perform their health assessment and community health plans. This is known as IPLAN. And obesity and physical activity continue to rank as a high priority in those plans. This is exactly what prompted our association to initiate the Illinois Chronic Disease Prevention and Health Promotion Act, which was enacted in 2008. Given that local health departments are the recognized entity for the development of IPLAN through their community collaborations, and ensuring that core functions of public health have already been executed and assessment and community health plan implementation has taken place, and infrastructure now needs to be developed. Thank you.
I just have a question. Many of the organizations we've heard from so far seem to be doing a lot of that, trying to pull together all these organizations in different parts of central Illinois. And as you know, I'm from northern Illinois. Is that being done through the IPLAN, or are they being utilized, or are people just doing this on their own?
Most of these collaborations are being put through the implementation phase of IPLAN. The problem that I was getting to is the fact that there are absolutely no resources. So public health departments are strained every 5 years when they do their IPLAN, and then the implementation phase is where these collaborations are put together. The staff time, the organization is not funded, and so as a result, I think as time goes on and further pressure is put on them economically, I think what you're going to find are local health departments are going to have to cut back at a time when we really need to ramp up.
So we're funding planning, but not the implementation and the ongoing?
To a large measure, we're not even funding planning. That was a requirement that was put in back in the 90s, and there was never any money put into play to actually even design the plans or implement them.
Okay, thank you.